first person you'll hear from is Barbara. Barbara has appeared in previous podcast episodes. She spoke about her love of a nightly bath ritual and her Qigong practice. Barbara has chronic fatigue syndrome and fibromyalgia.
I'm a 60s kid, so I was familiar with marijuana before I had any kind of chronic illness. I started actually smoking it occasionally just to see what the effect would be. And I found it made a huge difference for me. Emotionally, but physically. It's a great anti-inflammatory. And I've become a little bit more of a connoisseur, so sometimes I'm just wanting to have very high CBD, which treats the pain, and with very little cognitive changes. And other times I just like to go for the ride for the whole thing. I try not to smoke it because I don't really want to be smoking all that much. When you vape, you're basically melting the crystals. When you smoke it, you're also, you're burning that leaf. It has a different impact on the body than just vaporizing. And truth be told, I'd prefer to smoke it for the high that it gets and the way I feel. I feel better when I do that. Or I do edibles. I'm a fan of the caramels.
Cheryl is no longer growing plants, but has found some relief using other cannabis products after a recent hospitalization that left her with painful burns from neck radiation.
I was super, super, super sick. By that I mean I couldn't swallow my own saliva. I was in agony. I had face sores and mouth sores, and I was an absolute wreck. And also a fair amount of panic, because it felt like such an extreme treatment. And in my head, I was thinking, they would not do this to you unless you were really sick. I mean, why would they? It's like criminal to be tortured like this. So I was panicking on many levels. And my daughter came over with throat lozenges with THC. And they were 40 milligrams of THC, which is a super lot. And I found that if I could keep it in my mouth for 50 seconds, it would soothe my throat agonies and not get me so high that I was miserable, because I really was miserable. One time I got like high in the first minute and then forgot to take it out for like 5 minutes. And they kind of tasted good too. They were nice flavors, watermelon and whatever. But anyway, I took it out of my mouth after a minute from there on. And I was just about right. I still had to sit in bed and color, like I was kind of doped. But I wouldn't drive a car or try to talk on the phone or do anything. But it really medicated the pain amazingly well.
I am a big proselytizer for the use of medical marijuana. I have a prescription for it. And where I go to get the prescription, there is a very real ethical doctor who will actually spend more time talking to you about their prescription and how they think that you should use it than the amount of time that you get with a normal doctor at your HMO. For example, I see my psychiatrist at my HMO on a regular basis. Every 6 weeks is all I'm allowed to see him, unless it's an emergency. And he can't give me more than 25 minutes max before he has to see another patient. Now, this doctor at Compassionate Care spent over half an hour. I lost track, could have been 45 minutes. But it was a very leisurely visit in which he covered everything about my medical history. And in fact, you have to fill out a 4-page form about your medical history before you can be seen by the doctor. So in addition to having all of my medical history written, he spoke to me at length about exactly how my bipolar disorder affects me, which strain he thought would be most effective, because sativa is kind of an up strain and indica is more relaxing. In fact, indica, I used to have trouble remembering the difference about sativa and indica. And in grad school, a classmate said that he uses the phrase indie couch to think of indica. And that does make it very clear.